So my name is Andrew Young. I'm a physical therapist with iMove. I've been working with iMove for about 6 years. Um, you can see there in the picture, that is my wife, Kylie, and I hiking out in Banff in the Rockies. It's a beautiful trip, and my new daughter, Lucy, over there, she's 8 weeks old. I'm a little sleep deprived, but still enjoying every second as she's getting a little bit older. So that's who I am. But the next question is who are you and why are you here? And I suspect that most people participating and listening in are interested in getting rid of shoulder pain. Everybody has their own story. Maybe there's an injury in the past. Maybe shoulder pain kind of slowly started creeping up and getting worse over time. But I imagine that we all have the same goal, which is getting rid of pain and participating in activities that you're passionate about. So as we move forward, we are really interested in your story because everybody's story is a little bit different. I have a colleague of mine, Jeff Clark, who is also on the call. So he'll be reaching out to you in a chat box. So if you guys have any questions at all throughout the presentation, or if you want to share a little bit of your story, that maybe at the end we'll circle back, we'll talk about questions, and also if you have anything specific that you would like addressed, we'll go over some of that information. So please feel free to engage with Jeff as we move forward and continue to go through some of this material. So one question is, how do you know if you're in the right place? There are a lot of options out there for treating shoulder pain and trying to heal. So the first characteristic or the first quality that you may have to know if you're in the right place today is your pain reproducible? What I mean by that is, are you able to find a pattern or mention specific activities that seem to reproduce the pain that you're having? For some people, maybe it's, okay, I have shoulder pain with reaching overhead, trying to grab a dish on a high shelf. Maybe it is having shoulder pain while you play golf. I have a lot of patients in the clinic who have shoulder pain while they're trying to sleep, and the ache in their shoulder really prevents them from sleeping well at night. But if you can't identify a pattern or an activity that seems to correlate with your pain, you are in the right place. The next characteristic or idea for knowing if you're in the right place is if you've tried some self-management in the past. There are a lot of options out there. My guess is most of self-management includes some variation of ignoring it over time, hoping it'll go away, trying to alter it, maybe trying heat or ice or various stretches, or trying to change it. Maybe you've limited your activity, maybe you've done some strength training to try to change it. But if you've attempted to change and manage the pain on your own, or just hoped it would go away over time, you're in the right place. And then finally, you are in the right place if you are here to treat the dysfunction instead of the symptoms. What I mean by that is I would qualify pain as a symptom. Now, I'm not trying to say that pain is unimportant. Pain is definitely important, and one of the goals is, well, the main goal is to reduce pain over time. But we also need to dig a little bit deeper and ask the question, why is the pain there to begin with? It's one thing to say, okay, I am having pain, maybe it's from my rotator cuff, and it's preventing me from doing certain activities. But especially if you haven't had a specific injury and the pain has slowly crept up over time, we need to ask the question of why is the pain there to begin with? Is there something going on underlying the symptom of the pain that we need to address and improve for healing over time? Here's a nice quote from Albert Einstein that I really like is, insanity is doing the same thing over and over and expecting different results. I think a lot of people who have shoulder pain or knee pain or lower back pain get really frustrated. They try to manage it on their own. Maybe they give the pain time, hoping that it will heal. But at a certain point, if you've had pain for a while and it's not changing, it's time to do something different. And one of my goals here today is to guide you through some thought processes regarding diagnosis and potentially treatment and next steps, so that you can start doing something different and hopefully get on the road to healing. So before we get into the meat and potatoes of the presentation, everyone participating today, you will be eligible for a free 30-minute complimentary consultation with an iMove clinician. You'll receive an email when we're done with the presentation with a link to that offer. So we'll talk about that a little bit more at the end, but I would encourage you to stay tuned because we'll talk about that option for you to participate in a free session. So a lot of people ask me when I'm working in physical therapy, Andrew, how did you get into physical therapy? What piqued your interest in studying the body and healing and how things work as a system? And for me, my story starts when I was in high school. I was an athlete and I had a really significant ankle sprain. I jumped and I came down and I had a really hard ankle sprain that swelled up like a balloon, black and blue, hurt like crazy. And thankfully I had a really great athletic trainer. So, I walked into the training room and of course the trainer looks at my ankle and starts to treat the swelling, puts ice on there to try to reduce the pain. But that's when my trainer did something really interesting. He said, Andrew, before you leave the session today, I want to make sure you're stretching your hip out. And I was a little bit confused, honestly, thinking, okay, you see my ankle. The ankle is the source of the problem. Why in the world are you asking me to stretch my hip? And he really patiently explained that our body works as a system. When you are trying to walk or run, hip mobility and hip strength has a significant impact on how the ankle functions and the amount of pain that you could have at the ankle. So that's really the first time somebody explained to me, how the body works together and why it's important not just to treat the site of injury, but also kind of step back and look at how the body works as a system. So that led to a long journey for me, including an exercise science degree from Hope College, earning a doctor of physical therapy degree, clinical rotations at Duke University Medical Center and Wake Forest Baptist Medical Center. All learning and gaining skills and understanding about how our body works as a system. And this applies to rotator cuff pain and shoulder pain, which we'll get into here in a minute. So an overview of what we will cover today. Number one, we're going to talk about the three most common types of shoulder pain. And what I mean by a type of shoulder pain is really a medical diagnosis. A tendonitis, a tear, that sort of a thing. The second topic is the three most common causes of shoulder pain. So in this area, we're going to go kind of a level deeper and talk about what underlying maybe muscle weakness or lack of mobility could predispose your shoulder to irritation, pain, or injury. And then the last section of the presentation is going to talk about the three most effective treatments for shoulder pain. And we'll go over a few specifics there, hopefully, to help you get started. So number one, the three most common types of shoulder pain that I see in the clinic. First, we're going to talk about arthritis and joint degeneration. So arthritis and joint degeneration basically means joint space narrowing, changes in the cartilage of the joint over time. Sometimes it includes the formation of bone spurs. But basically, it is the interface of the ball and socket joint just isn't as healthy as what it used to be. Shoulder arthritis is pretty common, but not quite as common as it is in the hip and the knee. In some studies, they actually find about a third of Americans over 60 years old actually do have shoulder arthritis that shows up on an X-ray. So it is prevalent and it is a pretty common issue. There are two types of arthritis or two sort of ways that arthritis will start. Primary arthritis is just meaning the arthritis starts with no apparent reason. It's not like there was an injury or anything that happened and the arthritis formed afterward. Secondary arthritis is coming after an injury or some significant wear and tear. So with secondary arthritis, we can usually go back and pinpoint an injury or a time when the arthritis would have been likely to start developing. There are a few risk factors for developing arthritis in the shoulder. A previous injury is one of them. Age, it seems like women over 50 tend to be a little more likely to develop shoulder arthritis, although it is definitely present in men as well. Obesity seems to make you a little bit more likely to develop shoulder arthritis. And there also seems to be a genetic component. Symptoms of shoulder arthritis they can vary. There's a pretty wide range, but in general, obviously there's going to be pain associated with arthritis, but I would say the primary driver is like stiffness, especially stiffness in the morning or after a period of inactivity. Pain and stiffness together. I would say those are two of the main characteristics, and then additionally, clicking, popping, catching, sometimes grinding in the shoulder, that can also be associated with shoulder arthritis. Bone spurs can also develop over time. This is kind of in the degeneration or arthritic category. The development of bone spurs, it is an important thing to track and observe. Your shoulder works in a really specific way, and there's a rhythm where the shoulder will, the arm bone will come up and lift overhead, and the shoulder blade will move. If you have bone spurs, there's potential to mess with that rhythm of shoulder movement, and can potentially cause irritation to your rotator cuff or sometimes a bursa in the shoulder joint. Next, we're going to go over soft tissue injuries, and rotator cuff injuries are in this category. So we'll get to that really quickly. The first type of soft tissue injury that I would cover are sprains. So a sprain is damage to a ligament or potentially the joint capsule. So you can see in the diagram there on the screen, there are a lot of ligaments that connect to your collarbone, your clavicle, and those can be sprained, which have an impact on shoulder motion and mobility. And then also you can see a little bit further to the left, there's that really thick band. It looks like a really massive ligament. It's labeled as the glenohumeral ligament. That is part of the joint capsule. And all synovial joints, ball and socket joints have a capsule, and it's kind of a thick fibrous tissue that surrounds the ball and socket joint and really contributes to stability. So you can also sprain that tissue as well. Strains would be a muscle issue. So, just like you can strain your hamstring, you can also strain the musculature of your shoulder. It could be you could have a rotator cuff strain, not necessarily a tear, but a muscle strain, which would be irritation. You can strain the biceps. You can have issues with the musculature surrounding the shoulder blade. But a really big one that occurs often, I'm sure that you probably know someone who has had a rotator cuff issue, would be a rotator cuff tear. They can occur with or without trauma. So, sometimes people will come into the clinic and they can pinpoint the exact moment that they had a shoulder problem. Maybe there was a slip and fall on the ice, or, they were doing something really, really heavy, like, moving a tree around in their front yard, and, they feel a pop, and, they can really pinpoint the moment. But you can also have a rotator cuff tear that you can't really pinpoint to the moment where it started or where it happened, but could be kind of a slow build in pain over potentially 2 to 3 months. And there are various grades and severities of rotator cuff tear. The most severe would be a full rotator cuff tear. You can have varying degrees of partial rotator cuff tears as well. We talked about bone spurs earlier. That's a good example of sort of a degenerative change that could predispose you to small rotator cuff tears over time. Significant rotator cuff tears, you will have a lot of weakness in the shoulder. Often people have a hard time even lifting their arm to shoulder height. However, the partial tears, or the tears where the pain slowly comes on over a period of months, a lot of people will be able to maintain full range of motion, even though they have an underlying rotator cuff tear. Often these people present with like aching pain at night, pain that wakes them up out of sleep potentially. I have all sorts of people with rotator cuff tears, partial or full, who say they feel pretty good during the day, but as soon as their head hits the pillow at night, that sucker just starts to ache and throb. So that would be a common characteristic for a rotator cuff issue. Another type of soft tissue injury or irritation would be a bursitis. Bursa, all it is a fluid-filled sac that helps with cushioning and lubrication of the joint. These can become inflamed and irritated, especially if the mechanics of the shoulder joint are off, or if there was a direct trauma. A slip and a fall is a good example. Those can become pretty sore. Common presentation for a bursitis would be constant pain, gradual onset over time. You tend to have an aching pain in the lateral shoulder, kind of over the deltoid region, if you know that muscle. Difficulty laying on that side in bed. Just the pressure and the compression can be irritating. And then also there could be trouble with overhead reaching. And then the last type of soft tissue injury I want to talk about today would be a tendonitis. This can be caused by overuse, leading to inflammation over time. Often it can be hard to hold your arm in certain positions or perform certain activities. But this presentation would be a slow build in pain over time. Often there can be stiffness associated as well. So that's another type of common type of rotator cuff issue that I see that's not a tear. The last diagnosis or type of shoulder pain I want to go over is impingement syndrome. Impingement is more of a pinching feeling or a painful arc. And what I mean with a painful arc is somebody will come in and they'll lift their arm up overhead, and there will be a range as they lift their arm up overhead where they feel the pain. If they're below the range, they feel pretty darn good. And if they're above the pain or the range, they feel pretty darn good. But there's maybe like a 10 to 20 degree arc where they get a pinching, irritating pain. So that's a common characteristic for shoulder impingement. Usually the issue here is that the arm bone, the ball and socket joint isn't moving well, isn't in rhythm with the shoulder blade. Those things have to work together as a system. And shoulder weakness or stiffness in certain areas can change the rhythm, predisposing you to pinching and irritation in the shoulder joint. You can see in the photo here, there's a picture of the ball and socket joint of the shoulder. And actually, one of your rotator cuff muscles, the supraspinatus, is right on top there. It's labeled. That supraspinatus muscle, it's the most common rotator cuff muscle to be torn. It runs through a very narrow space, usually about 9 to 10 millimeters of space. And if the rhythm and pattern of your arm bone, if the ball and socket joint and the shoulder aren't moving in the correct rhythm, that space can become smaller and cause pinching on that particular muscle and irritation. It also could cause pinching on the bursa in that particular area. So for impingement, think pinching pain in a really specific range. Something that predisposes people to impingement syndrome of the shoulder is bad posture. We all have bad posture. I'm sitting with bad posture right now as I do this webinar. But you can see in this picture the slouched forward position. If you can imagine the shoulder joint and the shoulder blade, when you're slouched forward like that, slides to the outside and causes that space to narrow where your rotator cuff runs through. So sitting tall and actually having good mobility through the middle part of your back, the upper part of your back, is really helpful when treating impingement syndrome of the shoulder. So those are some of the most common medical diagnoses that I see in the clinic. But now I want to go one level deeper, especially if you have shoulder pain and you have a hard time remembering an exact injury, if the pain has slowly come up over time. This is a really important section to pay attention to, because we're going to talk about what underlying factors could have predisposed you to the pain starting. So we need to look at 3 different areas of the body and how they move and how that could affect the shoulder. So one, we want to check another part of the shoulder girdle. Number 2, we want to look at the spine and how well that is moving. We also want to look at the hips. Believe it or not, with certain activities, especially if you're reaching up and away from your body, if you don't have good core and hip strength, you're going to have extra load go through the rotator cuff muscles, and that could predispose you to some irritation. The key here is that our body works as a system. The shoulder does not work only in isolation. Do we need to examine the shoulder specifically? Absolutely. We need to try to figure out what tissue is the pain generator. But we also need to look at how your body works as a system. Do you have enough flexibility and do you have enough strength to allow the shoulder to move in the way it was designed? The shoulder design, it's a pretty amazing structure. You have a lot of motion, but it only has so much to contribute to certain activities. It has 180 degrees of motion in front of your body. It has lots of rotation, internal and external. But if for some reason, your upper back or your shoulder girdle is stiff and you're asking your arm and shoulders to do a certain activity, but you don't have the range of motion to complete it, or you don't have the strength to stabilize the shoulder, or the strength to have the shoulder blade and the arm bone to move in sync, that can predispose the shoulder to being overworked. So the idea here is we need to pay attention to the shoulder, but we also need to make sure the entire shoulder girdle, including your collarbone and your scapula and all the articulations of those bones, are working well. We need to make sure your upper back and spine is able to extend and bend and move, because that sets up your shoulder for success. And we also need to look at core and hip strength, depending on your activity. A great example here would be a golfer. If you have shoulder pain with golfing, think about all the rotation that's required for a golf swing. If you don't have great rotation at your hip joint, but you're asking your shoulder to do this huge rotational movement, your shoulder can only contribute so much. And if your hip can't kick in and contribute, it predisposes you to injury. So what does successful treatment look like? It looks like viewing the body as a whole system. We should be looking at your clavicle or your collarbone. We should be looking at your shoulder blade. We should be looking at the ball and socket joint. We should be looking at how your spine rotates and bends and extends, because all of those work together for you to successfully be able to move your shoulder. We need to make sure that your spine can rotate. The example from earlier about a golf swing, or if you play pickleball or anything that involves rotation. If you don't have good rotation through your spine, but you're asking your shoulder to do that huge rotational activity, it puts your shoulder at risk, or it predisposes it to being overworked, and then some injury and irritation. Having your hips be mobile and strong, it is important for the shoulder joint. The golf swing is another good example. But in addition to that, if you even think about, okay, I'm reaching overhead into a cupboard in my kitchen to grab a dish off of a high shelf. If you don't have the stability in your core and hip joint to stand and reach into that motion, and you're just relying on your rotator cuff musculature to do all the work of that lift in that high overhead position, there's potential that musculature in your shoulder could be overworked and become irritated over time. So hip strength and hip mobility is important for addressing the shoulder holistically. So let's get into a little bit of treatment ideas for shoulder pain. We'll go through each of the most common medical diagnoses and talk about a few kind of general characteristics and ideas for you to get started on at home. So if you feel like you fit into the arthritis or joint degeneration category, remember that would be pain, but also stiffness in the shoulder, after a period of inactivity, or you get out of bed in the morning and man, that sucker is stiff. I would think about, the arthritis category for you. In this scenario, motion is lotion. One of my clinical instructors drilled that into my head a long time ago. The shoulder joint is a ball and socket joint, and it's full of fluid, synovial fluid, which is lubricant. And the more you can move the shoulder joint, the better that it's going to lubricate the interface of the ball and socket joint in your shoulder. Now, if you're having a lot of pain, it's not going to be comfortable for you to just sit there and move your shoulder all day. The point is that it hurts. But there are ways potentially that we could offload your shoulder and get it moving in a more comfortable manner. One example could be if you have access to a pool. If you get into the pool, into the shallow end, and you submerge and dip the shoulders below the level of the water, and you can move, the buoyancy of the water will take a little bit of that load off of the musculature and the joint, and potentially allow you to move more comfortably, lubricating the joint surface. The other thing I didn't mention with the synovial fluid is that it brings nutrition to the joint surface as well. So that's another reason why getting that stuff circulating is really helpful. Another easy exercise to start on for this category would be sitting at your dining room table, resting your hand on the table, and just sliding it forward and back. The table is going to support you, decreasing some of the load on the painful shoulder joint, and hopefully allow you to move the shoulder pretty comfortably and still get that thing lubricated and bring nutrition to the joint surface. So in the arthritis category, think movement, but with support. You could do the slides on the wall as well. If the table's too easy, anchor that hand on the wall and try to slide up and down. And that might be enough support for you to move comfortably. Moving to the next category, talking about soft tissue damage. This is a really broad category. I would say, if you can pinpoint the start of your shoulder pain to a specific injury, I would maybe think about including yourself in this category. In this circumstance, there's a time frame where you need to protect the irritated tissue for healing. There's kind of a normal healing time frame, somewhere between 2 to 4 weeks protecting that, but then you want to slowly progress load over time in the shoulder joint. So if you're backing off of a lot of activity, after 2 to 3 weeks, you actually want to start incorporating some strength training and some mobility into your program. So if you had an injury and you can pinpoint the moment where your pain started, you want to think about protecting the healing tissue for the first 2 to 3 weeks, maybe 4 weeks if it's really bad, and then slowly reintroducing movement over time. The final category, impingement syndrome. Think pinching, painful arc. My shoulder hurts, my arm hurts only in a certain range as I lift it above. We need to strengthen that shoulder. It typically it's an issue with the rhythm between your shoulder blade and your arm bone, the ball and socket joint. So for that, doing some really light strength training could be really helpful. A lot of people don't think about this, but actually doing a plank is shoulder strengthening. When you're on the ground and you're in a plank position, your shoulder has to be pretty darn strong to keep your body stable. You could even start just in hands and knees if it's pretty acute and pretty sore. You can get on your hands and knees on the ground and do some weight shifting, a little forward and back, a little side to side, maybe some circles, and just loading and putting a little bit of weight down through that shoulder is going to start strength training. Another classic exercise, if you're in the impingement syndrome, would be some rotational exercises. If you can see in the camera, just taking a little bit of weight and rotating in and out, or maybe if you have a stretchy band, doing some rotation in and out with that shoulder joint to build strength. Try to improve the rhythm between the shoulder blade and the ball and socket joint. And hopefully, you're trying to maintain space for your rotator cuff to live in to where it doesn't get irritated. So in summary, successful treatment, we have to remember to look at the whole body. Do we need to look at the shoulder joint specifically? Absolutely. We need to think about the whole system. And especially, if you have a shoulder joint that's really painful and irritated, sometimes the best option is to start working elsewhere because the body works as a team. Work on spinal mobility, some rotation, some flexing and extending through your upper back could be what you need to offload the shoulder joint and allow your body to heal a little bit. Successful treatment, especially if you're going somewhere and maybe seeing a doctor or a physical therapist or a chiropractor, should be one-on-one. We're talking in generalities here, but everybody is a little bit different. And so, if you're seeking assistance, having somebody sit down with you and really pay attention to your specific story is super important. And then the last 2 points here would be there can be a hands-on component, especially if you have stiffness. We're trying to improve circulation, gentle stretching, gentle techniques for the shoulder joint, combined with some type of exercise and movement for you to do on your own. That's the important part, is empowering you with the knowledge and the techniques that you need to start healing and start healing well on your own. Remember, we need to look at not just where the symptom is coming from, but the root cause, looking at the spine, the hips, and how the body works as a system. 2 more slides here, and then we'll go over a few questions. Something that I think is really important, people ask me all the time is, okay, Andrew, I've had an x-ray or I've had an MRI, and they tell me I've got a rotator cuff tear, or they tell me that I've got arthritis, or I've got a bone spur. What in the heck is physical therapy, or what in the heck is exercise going to do to fix the tear in my rotator cuff, or fix the arthritis that's in my shoulder? And it's a super important question. It's a pretty hot topic in research right now. So one of the ways that they're studying the body generally is they're doing these studies where they take big groups of people who have no symptoms at all, and they're giving everybody an MRI. The radiologist who reads the report doesn't know that these people have no pain, so it's blinded, but they're giving everybody with no symptoms an MRI, having it read, and then analyzing the results. And the interesting thing is that they're finding all sorts of people with, in the shoulder, you can see in the picture there, 22% of men between ages 40 and 70 have some kind of partial rotator cuff tear and have no symptoms. 78% of people in this study had some type of bursal thickening or inflammation around the bursa and the shoulder joint that showed up on an MRI. This one is insane. 96% of people had some kind of abnormality show up on an MRI. They had no symptoms at all. So it's kind of confusing and interesting. And I think the takeaway is, number one, your X-ray or your MRI is not your destiny. Just because you have something that shows up on an X-ray and an MRI doesn't mean that you are destined to having pain until somebody goes in there with little surgical tools and fixes it. The other important concept here is this idea of being symptomatic or asymptomatic. Being asymptomatic means you don't have any symptoms at all. You feel fine. Being symptomatic means you're having pain. And with arthritis, for example, you can have symptomatic arthritis, meaning arthritis that causes pain. But you can also have arthritis that shows up on an X-ray that causes you no pain at all. And I think that's where conservative treatment thrives, is in that window of, I'm not, as a physical therapist, going to go in there and scoop out the arthritis. However, could we build strength, build mobility, improve the efficiency of your body to where the arthritis that you have in your shoulder is no longer symptomatic? I think yes. Or, partial rotator cuff tears, the same example. Can we improve how your full body is moving to where that little tiny rotator cuff tear actually might not matter as much anymore, because the rest of your body is kind of picking up the slack and able to overcome that injury. So super interesting stuff there, and something that's important to keep in mind. And then I just want to go over this last study really quickly. It was a study done in 2014 where they looked at rotator cuff tears. They had 173 patients aged 55 years or older. They all had a supraspinatus rotator cuff tear, and they were randomly assigned to one of 3 groups. There was one group that just did physical therapy. There was one group that had kind of like a minor shoulder surgery plus physical therapy. They didn't actually repair the rotator cuff. They just went in and cleaned it up and did physical therapy. And then the last group was the full rotator cuff repair. They cleaned it up and they did physical therapy. And in this study, they found no difference between groups after 12 months. Pretty crazy and interesting stuff. Now, I don't want the message here to be that nobody needs a rotator cuff repaired surgically. That needs to happen sometimes. That is an important procedure, and if you're the right candidate, it needs to happen. It can be successful. What I think this does mean and highlight is the importance of fully flushing out conservative treatments first, giving your body the chance and the time and the environment to try to heal and overcome whatever injury is causing pain. Our bodies are amazingly adaptable. And I think it's smart to give our bodies a really good chance to heal on its own before starting to consider things that have more risk associated with them, like injection or potentially surgery.